All right, guys, let's get busy talking about our sleep stages. I went ahead and made a table for this because I think it's really useful to compare and contrast the different stages. So let's go ahead and start with our awake stage. This is when we have our eyes open. So there's two stages of awake. There's going to be awake with eyes closed and awake with eyes open. So let's start with eyes open. So the things that are going to characterize this is someone who's alert, present, and focused. So me, I'm alert. I'm talking to you guys. I am in this stage of sleep. So even though this is a sleep stage, this person is awake. And the important thing to know is on EEG, so that fancy electrode that goes on our brain and measures activity is going to be showing beta waves. But don't worry, guys, you don't have to know what a beta wave looks like. We will talk about certain waves that you have to know. Beta waves are not something that you have to be able to recognize on EEG. You just have to know that beta waves are associated with this awake stage, eyes open sleep. Next, let's talk about our awake, eyes closed. So this is when we're posturing for sleep and we're still conscious. So have you ever guys been like, okay, I'm ready for bed. I'm going to put my head on the pillow and close my eyes, but you're still awake. You're still thinking. You're still conscious. You can hear things. You can think about things. This is the stage of sleep that I'm referring to. And these EEG waves are going to be described as alpha waves. And these alpha waves, you do not need to be able to recognize on EEG, but you do need to be able to recognize the name. So moving on, let's talk about the N1 stage of sleep. And this is going to account for about 5% of our total time when we're asleep. And this is the stage that we refer to as light sleep. So this is going to be the first stage you hit right after you start losing consciousness. You're kind of fading away into your sleep. And the important thing to know about this stage of sleep is that it is the shortest of all the actually asleep stages, which I have in purple and pink, and it's associated with theta waves. Again, you don't have to recognize these theta waves on EEG, but you do need to know that they're associated with N1 stage. Now let's talk about N2 sleep. So N2 sleep is going to be the biggest bulk of our sleep time. So it accounts for 45% of our sleep, and this is a very deep sleep. So this is deeper sleep, and one thing that test writers like to ask about is bruxism, because this occurs during N2 sleep. You're like, Jake, what's bruxism? Bruxism is a fancy word for grinding your teeth. So that's something to be aware of because it may be mentioned as bruxism instead of teeth grinding. Something you might see on physical exam is a patient with ground down teeth, or maybe like TMJ from grinding their teeth all night. And it might ask you, what stage of sleep does this occur in? And it's going to be stage N2. Now, our EEG wave types here are going to be called sleep spindles and K complexes. And these are the one time that you have to be able to recognize these complexes on EEG. So I'm going to draw them out for you guys. So let's start with a sleep spindle. So normal EEG is going to look kind of like this. There's just going to be some like baseline noise. Neurologists are great at reading these, but from a step one perspective, it's all irrelevant to us. What really matters is what I'm going to show you is just a sleep spindle. So here we're kind of the normal zone, and a sleep spindle looks like this. So it's a really fat change from baseline. You can see that this is a big deviation here from our normal baseline. And then I'm going to draw a K complex for you guys. So a K complex honestly looks a little bit like a QRS complex on EEG. However, this is an EEG, and this is the characteristic of a K complex. It's like a big, wide hump, and that is characteristic of this stage of sleep. Lastly, let's talk about our N3 sleep, which is going to be 25% of our total sleep cycle, and this is the very deepest sleep that you're going to get. Okay, so this is oftentimes called slow wave sleep because it is so deep. It is so deep in sleep that people have what are called slow waves on EEG, but you don't have to recognize these, but just know that it's something that is associated with. Now, what's important here when it comes to N3 sleep is the pathologies that are associated with it. So in N3, we get night terrors, sleepwalking, and nocturnal enuresis, okay? And these are all associated with our EEG waves that are delta waves. You don't need to recognize these delta waves, but you have to know the name and the fact that they're associated with N3. So my mnemonic here is all about the sound E, okay? And I'm doing kind of extra, guys, but it helps you remember it. So when it comes to night terrors and sleepwalking, I think of haunted houses. So I think of someone like sleepwalking like E. And someone with night terrors is really scared, so they're gonna be like, E, I'm so scared. Okay, I know it's cheesy, guys, but this is what helps me remember it. And then when it comes to nocturnal enuresis, this is when kids go wee in their bed. So just remember that E in all exclamation points is a night terror. E is sleepwalking, and then nocturnal emesis is going to be wee, as if you go wee wee in your bed. So I hope this helps you guys remember this stage of sleep because it's pretty high yield. There's a lot of pathology here. Lastly, let's talk about REM sleep, which stands for rapid eye movement sleep. and this accounts for approximately 25% of our sleep cycle. Now, I like to think of REM sleep as when you're quasi awake, but with your eyes closed, because our mind is super, super active here. So, in our previous three stages of sleep, we were kind of getting deeper and deeper and deeper. When we get to REM, the brain kind of wakes up again and it starts doing some really interesting stuff. So, it starts doing memory processing. This is the stage of sleep where we have dreams and where we have nightmares. And this is important to differentiate from night terrors and sleepwalking. Because night terrors and sleepwalking, you're not conscious of that. A night terror is just pure fear, fear in its purest sense while you're asleep. Sleepwalking, you have no control over. It is just your body acting on its own accord. Whereas REM is a little bit more sophisticated. So things like memory processing, dreams with plots and interesting sensations, and nightmares that we're capable of remembering, all these things happen in REM. And REM is a lot more brain activity. And that's why I drew it in this pink color, because it's a lot more active for me. Importantly, there's no motor tone during REM sleep. So these people are not going to be moving around or sleepwalking because they don't really have any motor tone. This is also the stage of sleep where we get a lot of extraocular movement, which I'm going to highlight here in pink. And this is due to our PPRF structure. And this is the paramedian pontine reticular formation. So I'm going to go ahead and write that for you guys. It is the PPRF. Lastly, we have increased genital flow during our REM sleep, and this is the last stage of sleep before people tend to kind of wake up from their slumber or their cycle, and this is why a lot of men will have erections when they wake up from REM sleep, because they have increased genital blood flow to their genitals during this stage. Lastly, we'll talk about the sleep wave here, which is beta, and I want you guys to notice that this is going to be the same as when we are awake. So remember I was telling you, REM sleep is very active. It's almost as if we're awake, but with our eyes closed and no muscle tone. And that's why you're going to see those beta waves in both awake, eyes open sleep and REM sleep. However, you don't need to recognize the beta waves on test day, but you do need to know the name and the stage it's associated with. So to wrap up our discussion about the sleep stages, I want to give you guys a mnemonic. And this mnemonic is called Bats Drink Blood. And you will see that each letter here that I have highlighted corresponds to a stage of sleep and the corresponding sleep wave. So you'll see in awake, eyes open sleep, we have B for beta waves. In awake, eyes closed, we have A for alpha waves. In N2 stage, we have our sleep spindles and our K complexes. In our N3 stage, we have our delta waves, and in our REM stage, we are back to beta waves, which are the ones that most resemble when we are awake, eyes open. In terms of some changes to be aware of in specific conditions or populations, let's go ahead and take a look at our column on the right. In the elderly, we will see decreased N3 sleep as well as decreased REM sleep. Also, we see increased sleep latency here. So these patients are going to have a harder time falling asleep, but once they get asleep, they're spending a lot more time in the N stages than they are in the REM stages. Also, older people will have earlier wake times. Now, let's talk about depression. So depression is going to have decreased N3, decreased REM latency, increased REM sleep, increased nighttime awakenings, and earlier wake times. So this is kind of very similar to our elderly population, with the exception that we have more REM sleep. So whereas our elderly had decreased REM, in depression, we're going to have increased REM sleep, and also we're going to be awakening during the night, and this makes sense because a lot of times people with depression via our sick-e-CAPS criteria are oftentimes complaining of insomnia or difficulty with sleeping. In patients who have been given norepinephrine, we're going to see decreased REM sleep. And in those patients who are on alcohol or benzodiazepines, we're going to see decreased N3 sleep as well as REM sleep.